Well, first of all, I think the independent sector has come quite a long way recently. I think as little as 5 years ago, you could say that it wasn't transparent, that not everybody was up on their game in terms of quality and governance. We've certainly transformed that at Spire, and you can just see from the CQC scores that that's transformed in the independent sector, and that has to continue. There's a question around transparency on pricing, which obviously Finn is part of, and around consultants' practice. And that's a little bit complicated because there is obviously a debate. How much is a knee procedure? It depends a bit on the procedure. But that's work that we've done in making things more transparent that Finn will work on. And as this becomes more of a consumer sector, which is what's happening, then the pressure will be on those who aren't transparent to become transparent because that's what consumers demand, and we see that. I would hope that we are now seen as an integral part of the healthcare system. I always draw it as, here's the NHS, and people think, here's the independent sector as a little box outside. I think the way to think about it, here's the healthcare system with the NHS and independent sector inside the box together. And I think that is the case. And as a patient, you are almost certain to have an NHS patient pathway at some time in your life. You may also have a private pathway. Your private and NHS pathways, by the way, on one treatment may overlap depending on what's happening. And I think trying to create artificial barriers helps nobody, particularly the patients. And I think those barriers are breaking down. I think choice matters. Imagine the world in which we had long waiting lists and all you could do is wait and you had no choice. Now, you can argue, is it fair that some can afford to pay and not others? To which I would say, well, everybody who pays to go privately is taking themselves off a waiting list. And it's important, in my view, that independent sector providers also help with waiting lists. So we're both part of the solution, but also providing that choice. But I do think that choice is important because the choice creates options for people, it creates space. And I think this narrative will evolve and the proportion of private and NHS support will change over time. I think primary care and the role of the independent sector will grow, which is why we're building clinics. It's why we're moving into private GPs. I think it'll be a vibrant time. It'll always be a subject of debate, right? Healthcare is the ultimate political topic in the UK. If you work off the premise that the quality of the services we provide is high, the care, the systems, the governance, then it's a debate about, well, it's a good service, how do people access it, where do you grow in? I very much hope that we will become both larger and more integrated, more recognised, and that as a consequence we'll have a better health system. And I firmly believe we are and can contribute to that.